And Robert F. Kennedy Jr. is expected to take up a major role in the new Trump administration involving health issues. RFK Jr. says he may gut the nutrition departments at the FDA. He also says many ingredients in America's food are illegal in Europe. Now he's taking aim at Fruit Loops, using cereal as an example.
Why do we have Fruit Loops in this country that have 18 or 19 ingredients, and you go to Canada and it's got 2 or 3?
ABC News medical contributor Dr. Alok Patel joins me now for more on this. Dr. Patel, walk me through this and what we just heard, because you say Fruit Loops in the U.S. and Canada actually have roughly the same number of ingredients, but a big difference when you look at the dyes. So can you expand on that?
Absolutely, Diane. If you look at a box of Fruit Loops in both the Canada and the United States, they have roughly the same amount of ingredients, from ingredients such as sugar and different types of flour. The big difference is that in Canada, they are using natural dyes that are made from products such as carrot, blueberry, and watermelon juice to give Fruit Loops that color. In the United States, they're using artificial dyes such as red 40, blue 1, yellow 5, and 6. And some of these dyes in preliminary studies have been linked to certain adverse reactions in children, such as children with ADHD or autism spectrum disorder, more hyperactivity. So it is worth noting that there is some research happening in these dyes, but most importantly, parents should feel empowered to look at any products they're giving their children, look at the back and read the ingredients and make a decision about what they want to feed their families.
It's hard to do, though, Dr. Patel, if you don't really understand these things, right? We're not researchers. We're not in a lab. I do hear in a lot of parent circles a lot of conversations about this, particularly with red dye 40. So can you help us make sort of more educated decisions about whether this stuff does or doesn't affect our kids, or is it a matter of does your kid react when they eat it?
Well, knowing if your children react to certain foods in general is very important when it comes to food allergies and insensitivities. And at times, kids may have a reaction to a food and parents may think, oh, it's red 40. But it's important to note that food and talk to a healthcare professional. But I want to address something you mentioned, Diane. It's that processed foods are not very nutrient dense, but they may contain products that fill bellies up and a lot of sugar. So they're not a good option in general. What we want to be doing is pushing a healthy, minimally processed diet for all kids out there, and parents in general to not be fearful of products simply because of chemical names, but go and ask a trusted source about what these products and ingredients are if you aren't sure.
Now, RFK Jr. has talked a lot about vaccines. He has repeated some debunked claims about vaccines being linked to autism, but he's rejecting this idea that he's anti-vaccine. And he says he wants people to, quote, make individual assessments about whether that product is going to be good for them. So what do you make of that?
I think everyone can agree that we want parents, we want consumers of health information to get good, validated info when it comes to vaccines. I want all parents out there to ask questions and get all their burning questions answered by a trusted healthcare professional. But RFK Jr.'s track record in the past, he is questionable because he has had moments when he's linked autism to vaccines, which has been debunked by highly qualified studies. And right now we are looking at, in the past, the fact that there have been claims about vaccines that may have led to some misinformation and hesitancy regarding certain vaccines, such as the measles vaccine. Right now in the United States, we have 272 cases of measles, and RFK Jr. and his nonprofit, the Children's Health Defense Fund, was implicated in a misinformation campaign in Samoa in 2019 that led to thousands of measles cases. So it is important to also make sure that we're on top of information and that we're calling out debunked claims such as the link between vaccines and autism, which does not exist, according to many validated studies looking at millions of children.
Now, RFK Jr. also says he wants to stop recommending fluoride be added to drinking water. So small amounts of fluoride are found naturally in water. In the U.S., more has been added to the public water supply since the 50s to help with dental health. But some recent studies have suggested fluoride in high amounts can negatively impact brain development in children. I know major medical associations have said in recommended levels the benefits outweigh the risks. But this is another one. This is really tricky as a parent to decide what's right here. So how do you give guidance on this?
What I give guidance is first for parents to understand what fluoride is actually doing. So fluoride, the recommended amount in public water, according to the CDC and WHO, is about 7 milligrams per liter. That's a few drops of water in a 55-gallon vat. So it's not that much. It is naturally occurring as well. And fluoride can actually strengthen the enamel, the surface of teeth, protect our teeth against acid bacterial growth, and it reduces the risk of tooth decay. But you're absolutely right, Diane. An excessive amount of fluoride can lead to something called fluorosis, which is not good for bones. And there is some question about what that may do for developing brains. But all the research is mostly in a large amount of fluoride and in animal models. And in some communities, there is no access to dental care. People may not have the right amount of awareness. So fluoride in the water is also an equitable way to protect teeth. When people like RFK Jr. compare the United States to other countries or communities that have removed fluoride from their water, we have to pay attention to the fact that some of those places have awareness campaigns. They have fluoridated toothpaste. They have salt in fluoride, such as certain countries in Europe. So it is widely accepted that fluoride is good for our teeth, but it is worth noting that we should be looking at studies about the right amount and if people have access to it.
And how much of it is a question of fluoride being ingested versus fluoride topically, like when you use a fluoridated toothpaste and you're putting it on your teeth rather than drinking water with it?
I think that's another area that we really have to look at guidance from organizations such as the American Dental Association, because in some preliminary studies, we have shown that in a community that does not have fluoridated tap water, but there is widespread campaigns in making sure kids have topical fluoride, that the risk of tooth decay, there isn't much of a difference. But in communities where we don't have that topical fluoride and they don't have fluoridated tap water, the risk of dental caries or tooth decay actually goes up. And those studies have been seen. So it is, again, another question that we need to be looking at. Which one is better? What is the right amount? But as we know right now, the place to go to get information is from major medical resources and your dentist if you have access to one.
Any advice, or is there a club we can join for parents that are just exhausted trying to follow all of this? Asking for a friend.
Woo, that club is Talk to Any Health Professional. If you go online, make sure you have a validated source. You know exactly where you're getting your information from, because, Diane, as we've seen, when it comes to food ingredients, vaccines, when it comes to fluoridated water, there's a lot of topics out there where there's a lot of pseudoscience in the world. So I encourage all parents to ask those questions, and healthcare professionals, we should never push somebody away because they're asking questions. We want to all be on the same page, and that page is protecting children.
That's right. ABC News medical contributor Dr. Alok Patel. Always glad I can text you when I have 5 million questions about these things. Dr.
Anytime,
Patel, thank you,
anytime.
friend.